You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. On today's program, we are discussing the keys to creating a natural-looking breast lift or augmentation. If you are unhappy with your breasts, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is a double board certified plastic surgeon, Dr. Ahmadi. Dr. Ahmadi is the founder and medical director of Avante Cosmetic Surgery in Sugar Land, Texas. We've invited him on the program today to discuss the keys to creating a natural looking breast lift or augmentation. Dr. Ahmadi, welcome to the program.
Thanks for having me, Randy.
And before we get into today's topic, and we've had you on the program before talking about the lipotuck.
Correct.
For those that don't know about Avante Cosmetic, tell me about it.
I do mostly cosmetic surgery, and that mostly involves facial rejuvenation, breast rejuvenation, and body contouring.
Okay. You do facelifts as
Facelifts,
well.
yeah. And that can involve short scar facelifts or more involved neck lifts. I do a variety of fillers, including Botox, and moving down, there's always the breast augmentation, breast rejuvenation, including breast reduction and lifts, and there's the lipotuck that we talked about.
Yeah, the lipotuck, we had you on the show before. A lot of response from that.
A lot of response.
A lot of people.
A lot of happy patients.
So that's a tummy tuck.
And very aggressive liposuction, that's right.
And very aggressive liposuction, but not a lot of guys do it.
No, it's not really designed for the male body because most men carry their fat, as you know, inside, and it is not really amenable to liposuction and skin removal.
So for women? It's
mostly for women, and the ladies have had some extra skin and some extra fatty tissue around the torso to give them a very natural look around the corners, to create a very natural waistlines and a very flat upper abdomen, and get rid of those bra rolls that they always complain about.
All right, okay, on to the breast. But first, your background, you're trained, double board certified plastic surgeon. What are the certifications? I'm
board certified in general surgery, and then I moved on to become board certified in plastic surgery. I went the longer way because I felt that it was better for me to get a lot of training, and that has helped me a lot in my career right now to be able to take care of my patients very carefully to make sure that there are no complications.
Moving on to the breast, what are the different categories of patients that you see?
Well, the ladies come into the office with a variety of desires and complaints and issues, but to break it down for you, basically the breast rejuvenation is either breast augmentation or breast reduction or lift, or a combination of these procedures together.
Now, we invite you on the show to talk about how to create a natural looking breast.
That's right.
It seems straightforward to me.
It is not really, actually.
I mean, it seems that everybody's doing them the same way, and one of the things you say is no.
It's quite tricky, actually. In order to a natural breast, if you look at it, is there are a couple of factors. One is the cleavage. The cleavage needs to be addressed very carefully, and people, for the most part, think that the cleavage can be modified. But the truth of the matter is that you're born with your cleavage, and if you try to modify it too much, that's when you end up getting the very unnatural look that you try to avoid.
So there are surgeons that what? Dig into the area, cut it?
They try to overdevelop the pocket and forcefully push the implants towards each other.
And what happens?
And basically end up seeing the edges of the implants because they have thinned the tissue so much and the implant becomes so much closer to the skin.
Interesting. That
it loses its natural look that was meant to have.
What are some of the motivations that you hear on these consults? Why do they want to do it?
I hear a lot of stories. I hear the stories of the younger ones who are obviously flat-chested, they don't have a whole lot of breast tissue, and breast tissue is very important to the well-being of a lady. No matter how you look at it, it is part of their body, and it's important for them to have enough breast tissue so that they look natural and out there.
Okay.
So there's always the young lady who sits in the back of the class, probably shy, doesn't have a whole lot of friends,
right?
Doesn't hang out in the in the cafeteria too much, and we probably don't see her swimming out their way. That's a typical young lady who's flat-chested. Then you see the other ladies who have used to have quite a amount of breast tissue, and after breastfeeding and age and all that, they saw the breast tissue flattening away, and then bring me pictures of those younger days, and they wish to look
kind of restore that volume.
Restore that old volume. So there are those who never had it, or those that who had it and want to go back to having it, and there are of course the older ladies who through age and all that have lost breast shape and volume, and would like some restoration in that sense. So aside from wanting just to go bigger, they trying to look more symmetric. They're trying to look much better out there in their sexy clothing. I mean, you've seen the fashion shows, you've seen the fashion magazines, and you see the ladies showing their breasts. It's part of our culture now.
Cleavage, right?
Yeah, cleavage. You know, it's all about cleavage nowadays, and that fullness that you carry around, you know, on your chest. It's become part of our mainstream culture, and these people are just trying to be involved and fit in, basically.
Let's talk about technique, because even though it seems straightforward to me, let's start there with over the muscle, under the muscle. I mean, what do you do? What's the best? My
approach to breast is probably the less you do, the better.
What does that mean?
Well, the more you try to manipulate the breast, I think you end up damaging that breast tissue more, and that later on causes more problems with scarring.
Okay.
As for the techniques, obviously, you know, when breast augmentation started, the implants were placed above the muscle or below the breast tissue.
Okay.
Nowadays, we know that the better pocket for it is below the muscle, because that protects the implants a lot more.
So for the most part, you always go below the muscle?
In general, unless there is absolutely a very, very good reason not to go under the muscle.
But why do some guys just do over the muscle? I mean, it's still being done today. Is it an easier procedure, you think?
It is much easier to do, but it's not a better procedure. I think the plastic surgeon should take the time to be trained well enough to handle that pocket, which is the below the muscle.
And what about the incisions? Some, you know, I guess through the belly button, the armpit, through the nipple area.
You have to listen to the patient.
Under the fold.
Exactly, you have to listen to the patient.
So what's best?
Commonly, the easiest, the one that disrupts the breast tissue the least, is the best. There are people out, some of the ladies come in and say, I want to be able to breastfeed afterwards, even though there is no guarantee to be able to breastfeed at all.
Okay.
But that is a determining factor, because if you go through the areola, through the nipple, then you're going exactly through the breast tissue that she was trying to tell you to not to disrupt, because she wants to be able to breastfeed.
So you don't like going through the nipple area?
Not necessarily. You try to match the procedure for the patient and what.
So where do you go?
Most plastic surgeons, including myself, end up going through the fold, because your breast is
underneath
the fold, underneath. Other ways of going it, as I said, is through the nipple. But if you're going through the nipple, you probably should reserve that procedure for somebody who wants a slight lift of the nipples, or needs a slight lift of the nipples, because you're already giving them the scar. You might as well take advantage of it and make sure that the implant sits very naturally and centered under the nipple areolar complex.
Now, what do you say? Now, I talked to a surgeon. He says, but going through the nipple area gives you more control of the implant, of that pocket.
Not necessarily. Once you're inside, you should be able, if you know what you're doing, you should be able to control that pocket from any point, no matter what your access point is.
Okay. But most of the time, under the fold,
under is
good.
Under the best, because it disrupts the breast tissue the
less
least.
Chance of losing nipple or sensitivity there?
There is, as I said, yes, there is, because the breast tissue is disrupted the least. So there is less chance of scar formation. There is less chance of breast tissue contracture. I've seen that with procedures where the scar around the areola was used, and as you dig through the scar tissue, through the breast tissue, it causes scarring, and that scarring stays there, and you can see actually ripples through.
So it's not worth the risk then, in your opinion, to go through the nipple area?
In general, I think for pure breast augmentation is somebody who does not require any manipulation of the position of the nipple. It's best to stay away from the nipple. Now, you have to remember that a scar through the nipple is always visible. You'll always see it. But a scar on the fold, underneath the breast, you may or may not see it. Most of the time you don't see it, because as the implant drops into its natural pocket, it will camouflage that scar very, very well.
Okay, what about the armpit?
It's a good procedure. It takes longer. It's more involved. There are
And why does a woman, I guess women come to you and say, I want through the armpit area? Do they ever say that? I mean, they're educated.
They do.
Today.
Most of the time it's because they think that the scars under the fold are horrible to deal with. But the truth is that nobody ever comes back to complain about the scars under the fold. You just don't see them.
So through the armpit is just purely...
It's purely preference by the surgeon at that point. As I said, it's more involved, and it's one needs to be extremely careful with that procedure because...
Why?
One has to disrupt the fold in order to achieve a natural look with that procedure, and one needs to make sure that exactly the same thing gets done to both sides, and that usually means that more time needs to be spent in the operating room to release the breast tissue around the fold so that the implant can drop. And if you don't do that, the implants end up being high with that procedure.
What about through the belly button?
Here's the main issue with going through the belly button. Even though you spare the patient the incisions over the folds or anywhere else, the problem with it is that the implant cannot be accurately placed into the desired pocket. There is no way to be able to place that implant under the muscle like you want it, release the muscle as much as you want,
okay,
and make sure that the same thing gets done to the other side exactly similar exactly
so just
similar
less
way.
Control.
It's a lot less control.
Are there guys doing it in Texas?
I know of quite a few surgeons who do it.
What we're going to do is we're going to take a quick break. Come back, you have photos.
Okay.
I have questions about silicone versus saline, and also how you determine size.
Very good question.
That day. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Ahmadi, and we're discussing the keys to creating a natural looking breast. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with the go-to guy, board-certified plastic surgeon in Texas that is getting amazing results with his patients. And we're talking about creating a natural-looking breast, and you say a lot of that is in the hands of the surgeon. There's
Correct.
art to it.
They're
not all being done the same way.
No. A lot of patients coming to the office seeking breast augmentation or lift, and they've been on the internet quite a bit, and they have bits of piece of information, but they can't put it together. So it's the job of the plastic surgeon to listen to them first, see what it is that they're after, and then guide them.
Let's start there. Day one, a consult. What happens when they're with you?
Well, you know, usually they're nervous, and sometimes they bring in pictures, and I start the interview basically by asking them what it is that they want to have done. What are the goals? What are they trying to achieve? Why they're having the breast augmentation? And there are a lot of stories, but usually comes down to about 4 questions, and that turns out to be what size, what sort of an implant, you want to go above or below the muscle, and what incision. Those are the 4 major questions, and you'd be surprised how different, what kind of information they have and what different answers they have to all these questions.
Do you want to know what they know?
Absolutely, because it tells me whether they're educated about the procedure or not.
Okay.
So I let them tell me or educate me, you know, about themselves, and then I take it over from there, because I find it important for them to tell me what it is that they're after.
How do you determine size?
Well, size is probably the most important factor.
For creating a natural looking breast.
Absolutely. Here are the goals. You want to achieve a very natural aesthetic goal. And how do you go on about it? Well, it's individualized. It doesn't matter whether you bring in someone else's picture out of a magazine. What matters is what you want to end up looking. Okay. And the best way to do that is try to implant on. The plastic surgeon
in your office.
In your office. The plastic surgeon should not tell you what size implants to go with right away. A lot of people come to my office and they have the exact CC because some girlfriend told them that's what size implant I got from another plastic surgeon. And I stop them right there and say, listen, breast augmentation is individualized. What fits on someone else's chest may not fit you. What matters at the end of this conversation that you and I are going to have in this office is what size implants are going to look good on you. And the best way to do that is just to try the implants on. So we get a bra, we get different size implants.
But how accurate is that?
It's very accurate.
Is it really?
It's very accurate. Basically, the only difference between what we're doing in the office and what goes on during the operating room is that the implants in the office are above the skin, and in the procedure they end up underneath the skin.
Okay.
So the volume is very, very accurate, and I tell them to bring a very tight-fitting shirt.
Okay.
And we have mirrors set up for this purpose where they can look at themselves, you know, head on and 3/4 and on the side. And I ask them to constantly look at their silhouette. And if they're comfortable with it, they usually end up narrowing the size of the implant very quickly. They know what they want.
Oftentimes they say, wow, this is way too big for me.
Not necessarily.
Okay, sometimes they need bigger.
What happens usually, they come in very shy about the procedure. The first word that comes out of their mouth is that I don't want to become too big. And I sit back and say, okay, go on. I'll let you choose the implants. Then I step out and my assistants help them with putting the implants on.
So your assistant's always there during
Absolutely.
this? A female assistant?
Yes, absolutely.
Okay.
And then usually what I end up coming back seeing is they've narrowed it down to 2 size implants. And the rule of thumb is if you narrow down to 2 size implants, you're already on your way to picking up the right size implants. And here's the rule of thumb. Always go with the bigger implants because that's what you really wanted. You may not verbalize it, but that's what you really wanted to begin with.
Okay.
Now, if you go with the smaller implants, I almost guarantee you, I'll put my money on that you come back and wanting me
a lot of regrets
to go and exchange it for the bigger implants. But the ones that went with the bigger implant of the 2, and we're not talking about a huge size difference. We're not talking about an entire...
So you're not one of these surgeons that does the big, giant...
No, I absolutely try to stay away from those giant implants purely because of the health of the patient and the fact that they have associated with a very, very large,
Because a young person turns 40 and then...
what's going to happen to the implant?
And plus those breasts don't look natural.
They don't,
professional.
And that's not what practice is about.
Good.
It's about natural look. And then the next discussion turns out to be silicone versus saline, and that is
that is a good question.
It's a very controversial issue. As you know, the FDA brought back the silicone implants.
So give me the advantages of both, the disadvantages of both.
The silicone implants absolutely feels more natural than the saline implants long term.
Okay. It feels
more natural, absolutely, because it's filled with silicone and it mimics the human tissue. The saline implants, which is made of silicone shell, it's a silicone bag filled with water, saline, it may or may not feel as natural, especially under the breast, closer to the fold. However, the silicone implant is associated with some other issues, including capsule contracture.
That's where they get hard.
That's when they get hard. Saline implant is associated with a lot less maintenance, and patients need to be aware of that.
What's popular in Texas, by the way? What seems to be the number one?
It seems that Texas, we seem to be doing more saline implants than silicone implants.
So you like saline implants?
I think I don't have a preference for either. I think the patient needs to be educated about the pros and cons.
Okay.
And make an intelligent question, an intelligent...
But as far as the look, will they look the same?
Look-wise, they look absolutely the same.
Okay.
Feel-wise, it really depends on how much breast tissue do you have to begin with. If you're absolutely flat-chested and you put put a saline implant, you will feel the edges of the implants.
Okay.
So depending on how much breast tissue you start with, because
that happens on the consult, obviously. You look at them and...
But what it is that the more breast tissue covers the implant, the less you're going to feel the implant. So if you got skin, breast tissue, muscle, and you got plenty of that, it doesn't matter what's really under it.
Okay.
It could be water, it could be silicone. So during the consultation, after the examination, I tell them what the advantages and disadvantages are, and then I tell them what I think they should choose.
Okay, okay. Now, breast lifts. After pregnancy...
Breast drop, correct.
But I heard it's a very tricky procedure.
It's a very tricky
scarring
procedure.
And things like that.
Well, the scars can be handled, but the tricky part of the procedure is you're augmenting and you're tightening. So it's a yin-yang thing. You're fighting two opposing forces, and there's a balance. There's a fine balance, and that's where it gets tricky. If you put a too big an implant in a small breast that you're trying to lift, you will have problems. Or if you try to remove too much skin over a big implant, you have the same problem. So there's a fine point, and that fine point turns out to be what size implants again you need to choose for that patient.
Okay.
And that is...
Now, some women with saggy breasts after pregnancy, some need some type of revision, some don't. Does that depend on how saggy they are? What?
Depends on how far the nipples have dropped in comparison with the fold.
Okay.
And whether they want to have a more of a rejuvenated look or more of a natural look. And how much scar are they willing to carry on their breasts? Because breast lift procedures come in a variety of forms and shapes. You can start with just a simple incision around the areola, around the nipple, and that may be just enough for somebody.
Okay.
And in some other people, you may have to take that scar down to the vertically down to the fold. And in some other people, where the breast has dropped a lot more, you may have to go across along the fold in the form of a ship's anchor.
Are these women afraid of that? Is that a big concern, the scar tissue after a lift?
No.
Because I've seen yours, by the way. We're going to show yours.
If you take care of the scars, if you take care of the scars and the scars fade away, they're absolutely okay with it. Randy, let me show you some examples of lift and augmentation.
Okay.
Very tricky procedure. Here's a middle-aged lady who has had 2 children. She has breastfed, and you can see that the breasts have dropped. You can see that the nipples are below the fold. Here's the fold. Here are the nipples.
So is this something you see a lot of?
I see a lot, and I want you to see the asymmetry. The right breast is a lot longer and has dropped more than the left breast.
Yeah.
And let's move on to the postoperative picture. And you can see how the volume has been restored.
It's very nice.
How the breasts have been pulled up. And I want you to look at that cleavage.
Yeah.
Very natural cleavage. And look at the scars. What do you think about the scars?
Yeah, you can't really see the scars.
The scars have faded away.
Put them?
They're right there. They're around the areola.
These are not touched up photos.
I have not touched up these photos. Good question. No, I have not touched them up. They're there.
I mean, this is a big
And this is only about
difference.
6 weeks out of the procedure. See, only 6 weeks after the procedure.
So what will happen as they go? They just become more natural and more natural.
The scars will fade away further and further, and you can see that the scars around the areola are almost imperceptible.
Okay, a few more we have time for.
Well, the next lady, younger, the breasts have dropped.
Wow, that looks like an older woman.
Well, she's not, but she has been breastfeeding, and she's had actually 3 or 4 children, this lady, and you can see there are quite a few stretch marks. That tells me that at some point she had quite a bit of a volume. She lost the volume as she went through the pregnancies afterwards.
Were
and all
her
that.
fears scars?
Absolutely. She was very fearful about the scars. And at some point I had to tell her that by just putting implants in there and not doing any lift, she would end up with a very, very saggy looking breast. And that would be the wrong path for her to take. So it took me some convincing to get her to accept the scars.
When you see this, by the way, do you say, oh, this will be good? In your eye.
Well, I know exactly what I'm supposed to be doing. You know, I know that I'm
but do you see it as an end result?
Absolutely,
oftentimes?
absolutely. Because I know that the implant has to go and the breast has to be lifted. So I know that I have to talk to this lady about scars.
Okay.
And here's a postoperative picture, and she's only about 4 weeks out.
She's got to be happy.
She's very happy. She has the volumes restored. The volume has shifted upward. The scars you can see around the areola are very imperceptible.
And these are not touched up.
And these are not touched up, and you can see how the scars, even the vertical scar that goes from the areola down to the fold, it's faded away. Randy, I want to show you a few more ladies. This lady has the same story as the previous one. You can see the nipples have dropped.
Are these younger patients?
She's about the same age as about the other
like 30.
one. But you know, baby boomers.
So after pregnancy,
the breast
drops.
tissue just completely lost, and the breast just dropped, and they were unhappy. And she was one of those ladies who came in with pictures of her, you know, back in the college days, you know, before having children, and she had nice large breasts. She was probably a cup C, you know, looking at those pictures. Now she may be a C, but the volume has shifted completely down. So she completely relies on bra.
So what do you do for her?
Well, I ended up doing a very short scar lift and an augmentation, and I want you to look at this picture and see how natural they are.
Yeah.
The scars are beginning to fade away. She's only a few weeks after the surgery.
Very nice.
But what I want you to look at is the tan line. This lady has been out there enjoying herself now.
Okay.
So
yeah,
she's
so
been
they're
out
wearing
there.
bathing suits.
Absolutely. Absolutely. She's absolutely out there enjoying herself. Do you have time for one more?
Go ahead.
Okay, here we go. This lady is a little bit more challenging, and it's obvious.
Why? Why is it challenging?
Well, besides the usual stuff that the nipples have dropped, the areolas have widened, and you can see that the left breast is completely longer and has dropped significantly more than the right breast. So now, not only I have to restore volume, bring the nipples back to their natural position, I also have to make sure that they come out very, very symmetric. Now, let's take a look at the postoperative picture. I used a moderate sized implant for her because she had plenty of breast tissue to work with. So I didn't have to use a big implant on her, which was very nice for her. And you can
I mean, that
see, that's a very natural
It's almost
look.
like a perfect
That's a very natural
job.
look.
I mean, perfect breast.
Well, I'm glad you agree with that, because that's a very natural look to me.
Yeah, it doesn't look
look overdone.
Yeah.
It doesn't look overdone. You can see the nipples are even.
Okay.
Whereas before, one was a lot lower than the opposite side. And again, the scars turn out to be very nice. What do you think about the scars?
Yeah, I mean, it looks good. How many weeks out is this?
She's about 6 weeks out, and you know that
they just fade over time.
In time, in a matter of months or weeks, they will fade away to become almost imperceptible.
Now, those are serious tan lines.
And
there, by
she's
the way.
been out there again. She's been enjoying herself, and this is a young lady that you can probably see out there, just tanning on the beach.
Good, good. We're out of time. And very good. A lot of information today. Final message. Somebody watching this, a woman watching this, unhappy with her breast. Where does it begin?
Call the office, make an appointment. My nurse and I will be more than happy to see you and go over the issues at hand with you. It's best to pick a surgeon that listens to you. Don't let the surgeon necessarily dictate the size of the implant. Don't be afraid of getting a lift. At the end, what matters is whether you look good in clothes or not, basically.
Okay, good, good. I want to thank you for coming on the show. Very, very,
thank you, Randy, for having me.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. All of the before and afters on this program could be seen on the doctor's website. If you'd like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.